Hello and welcome to the latest Greater Birmingham Chambers of Commerce Q&A session, and I'm delighted to be joined today by Karl Taylor, who's a regional manager at BHSF. Karl, hi, thanks for joining us.
Hi, thanks Paul, thanks for having me.
So Karl, just to sort of set the scene, give us a little bit of background into BHSF and how the organisation operates on a normal basis.
Okay, so BHSF as a business has been around for the best part of 200 years. Really well known within the Birmingham area, previously referred to as the Birmingham Hospital Saturday Fund. So some of you, some people watching this may know us better as that. But in sort of more recent times, we've sort of steered away from the health cash plan that created the business and relying on that solely into a much more diverse sort of, I guess, product range, leading more along the health and wellbeing route. And the current pandemic with COVID kind of plays quite neatly into that niche and the way that a lot of companies are treating their employees moving forward as well.
Exactly. So businesses will partner up with you, and BHSF provide a lot of sort of support packages for employees, isn't it?
Yeah, so commonly referred to as employee benefits, but I guess it depends on how you categorise that. A lot of the benefits that we provide are, like I said, featured based around health and wellbeing of the individual employees.
And so, as you say, you've been doing that for hundreds of years. The history of the organisation is something I really love. I think it's fantastic. But when COVID hit back in March over here in the UK, how did that impact BHSF, and how did you adapt your offering on services? It's, I suppose, in some ways made what you do even more essential, if that's possible.
Yeah, without doubt. In terms of our operation as a business, we very quickly moved to a home-based working operation. So that changed the way that we deal with our internal processes and made those a lot slicker as well, which again enhances the offering that we have to our clients and their employees. But in terms of the products that we do, quite luckily, I guess, for BHSF, trying to find a positive out of this very negative situation that we're in at the moment, we were already very firmly in the middle of a journey through to more enhanced products that better supported the mental health and wellbeing of employees anyway. And the products that we talk to clients about now are very much geared to dealing with the current issues that people are facing, which has just been exacerbated by the whole COVID pandemic.
Yeah, and it's in particular, I know the RISE product was something that was being developed or had been, sort of pre-COVID. Tell us a little bit about that, Karl.
So as a business, we've always, or I say always, for a long time, we've dealt with employee assistance programs, which are kind of a main staple in looking after the emotional well-being of employees. But one of the things that we've worked hard on over the last sort of 12 to 18 months is the development of the idea that an EAP service is very much just the basis. So it's the start point for looking after the mental health and wellbeing of somebody. The complexities of people's problems now are so great in that having access to a counselling service didn't really solve everybody's solution. It didn't solve everybody's problem, sorry. So we developed BHSF RISE, which is much more of a collaborative effect, bringing in expertise from various different fields to create a more 360-degree rounded package to provide different levels of support that can be completely tailored to the individual's needs. And then we structured all of that around a case management system to allow them to very fluidly interact with all of those different component parts and make sure that they get the best outcome, irrespective of the situation that they approach us with.
So if you're a company who's partnered up with BHSF and using your EAP or RISE in particular, then that the service that is being offered to your people goes deeper than just a sort of a one size fits all. Actually, it's designed to reflect the whole wide range of challenges and issues and ways of dealing with them that exist here and now.
Yeah, most definitely. And I think, not wanting to do a disservice to an EAP service, because like I said, for me, that is very much a main staple in that. It's kind of that start journey to looking after the emotional well-being of somebody. But what we know with RISE is that it can deal with much more complex issues and much more complex problems, which is absolutely key and fundamental in the way that people operate in the current environment anyway. But we also know that the level of expertise that's included within BHSF RISE means that irrespective of the situation that we're faced with, there is a specialist on hand that can help support somebody through that. And then we, like I said earlier on, we use a case management system to almost hold the hand of the employee through that entire journey. So it's not just solely on the employee to go through that on their own. They've got somebody with them, guiding them through that journey and providing them with all the help and support that we can.
And have you had to make any changes because of COVID? Have you had to adapt or enhance or almost was this, I'd say, good timing? Because as you say, there's nothing good about this situation. But RISE being a relatively new approach and product, it was already sort of fit for purpose for handling the I'm sure the surge in usage that you've seen since the pandemic hit.
Yeah, I mean, almost a Machiavellian approach to it, to be honest with you. It was like it's ready-made for a situation like we are now. The only real change that we've had to make is in terms of the face-to-face counselling aspect to it. So RISE comes with face-to-face counselling as standard, available to all employees. So obviously, having a face-to-face interaction with a counsellor at the moment just isn't, it's not practical. So we've moved to a standard approach of video consultations. So rather than it just being a telephone conversation with somebody, you're still able to interact with somebody on a face-to-face basis, pretty similar to how we are today. Yeah. And that enables the counsellor to get a much more in-depth read on the individual, how they're coping with the situation. They can look at people's sort of facial expressions, their body language, and they can see all of those things that you would be able to see if you were sitting in front of somebody, and just give a much more fully rounded approach to that individual.
And in terms of demand, I mean, what have you been picking up, I suppose, in terms of businesses who are already partnered up with you and just uptake from staff, and then also more inquiries from businesses? I'm sure are looking around. People are crucial to any business, and I know speaking to lots of different business owners or leaders, throughout this situation, the welfare of their people has been at the forefront of everyone's minds, I'd say. Has that led to more organisations signing up as well?
Without a doubt, yeah. It's led to more conversations with people that we perhaps wouldn't have spoken to before, and like I said earlier on, trying to take some kind of positive from this situation. The move from the move in importance that an employer was placing on their employees' mental health and well-being was already on the rise before the situation happened. But what this has done is accelerated that through a lot more businesses and people that perhaps it wasn't even on their radar at that point in time. They're now putting that right at the forefront of all of their decision making. They're asking themselves that question of, how are my staff coping with having to work from home, not being able to interact with people? How are they coping with being thrust into a more technologically driven environment that they perhaps weren't used to doing before? And what long-term impact is this going to have on my employees, not just today, but when they perhaps get back into that full working environment? And it's one of the key challenges that I think every employer faces at the moment is that massive unknown. Everybody's trying to plan for the future and what is going to come, what's going to happen when people get back to normal, but nobody actually knows what that normal looks like. So, they're trying to be very creative in their approach. They're trying to be very supportive of their employees. And for me, that's a very, very refreshing position for them to take. Yeah, no, it's very hard. Everyone's trying to look into that crystal ball and to plan ahead, but there's so many variable factors that are outside of everyone's control that it's difficult to do. And of course, that adds to that sense of stress and strain and the impact on people's mental health throughout an organisation, isn't it? And I think you're right. We've certainly seen in recent years such a growing awareness. Here in the West Midlands, the Combined Authority had their Thrive initiative, which did a lot to I think bring a heightened awareness within businesses and get businesses to engage and to think about sort of their approach. I mean, what are some of the common wouldn't say necessarily advice, but common challenges that you're picking up from businesses through this period, as that they're having with members of staff who are working remotely? Are there sort of 2 or 3 commonalities that are almost there across different business sectors? Yeah, there are, and I think it does. The business sector that a client works within does have an impact on how it's impacting their staff. naturally because of the type of work they do. But I think in terms of common themes, there's definitely a sort of an isolation issue that people are trying to help support with. More recently, there's been the return to work aspect, or the return to work fear, and what that's going to look like, how it's going to impact on an individual. You've also got the whole economic impact that the COVID situation is having on businesses and employees. Employees aren't silly. They understand the financial pressures that a lot of businesses that we work with are under. And they understand the long-term implications of that as well, and that creates its own sort of fear factor around it, outside of the whole COVID situation, and whether you're going to become infected or how you can not become infected and all that kind of stuff. There's also the long-term prospects of the job that you've got at the same time. So it's just a compounding impact, one on top of the other, and it creates it's almost like a perfect storm of issues for people.
Yeah, and so that's where you're able to step in and provide the sort of the support services for staff that businesses, best endeavours if they don't have any AP in place, and it can be very, very difficult to do, certainly at the best of times. And right now, when again, you're trying to deal with lots of challenges, you need to make sure you've got the support there. But if it's not built into your business, where do you turn? I mean, if people who are watching wanted to find out more, Karl, about RISE or different ways that BHSF can help, I mean, how easy and straightforward is that to do? Is that just a case of reaching out to yourself and colleagues and having a conversation? What's the sort of the process and timeframes involved?
Yeah, so in terms of getting hold of the information, there's a whole dedicated aspect of our website which talks specifically about BHSF RISE, which includes all of the main contact information, where you can register an inquiry and somebody from BHSF will call you back. In terms of the overall process, it's very simple as far as we're concerned. We like to talk to employers to isolate what the key issues are that they're facing, to determine first of all whether RISE is the right approach for them. Because it's great having that solution there, but it's got to be right for the client at the same time. And from a setup perspective, once the client's happy with the journey and the content of RISE itself, we made a decision right at the very beginning of this lockdown scenario, understanding the journey and how it was going to sort of transpire for people, that we would try and eliminate as much of the roadblocks as possible. So we can actually set a client up in as little as sort of 24, 48 hours if we need to. And we do that from having a written or an email sort of confirmation from the client. We get them put onto the service pretty much straight away, and then we deploy all the sort of supporting literature that we can to help promote that through their business as well. So it can be a very, very quick turnaround, and at the moment that's one of the things that's really important for a lot of clients.
And I'd imagine that given the context that you're also able to help and support with sort of pre-existing issues and challenges. If someone comes to you and they're going, we've got sort of people here who are really struggling, or who have been furloughed, or we're somewhere betwixt and between of them coming back, or even sadly maybe having to look at sort of redundancy situations, and that you're able to pick up from the here and now, rather than sort of exclude certain situations or people.
Yeah, without a doubt. I think it's one of the benefits of a service like RISE, that you can call that number whenever it suits you to discuss any problem and how it's impacting you today, and what we can help you then to manage those impacts moving forward. Obviously, we can't do anything to change the past, but if an employee was to contact us today, that whole process gets kick-started for them, and we provide them with as much support as we possibly can. And in actual fact, it's a scary thing to say, but I think I've actually lost count of the amount of clients that I've spoken to that have asked them specifically about people that are going to be going through a redundancy process. And how this can best support them as well. So it's not just about the employees that you've got or that are coming back. It's about those that are currently with you, but you perhaps know, or they know, that aren't going to be making it back into the business.
And again, for the benefit of those who are watching, I mean, where does this all sit in terms of cost, I guess, and value to a business? Is it one size fits all, or are you able to tailor it depending on size of workforce and the sort of the package that is needed?
Yeah, so in order to make it scalable, the actual cost is based on the headcount of an organisation.
Right.
So there is a minimum threshold, so a minimum cost of the service, and that's because there are key components in there that are just, you know, sort of immovable to a certain degree. But the service is charged at £1 per person per month,
Right.
so £12 per year. So it's really cost effective, and if that service can help to keep one employee within a business, it can almost pay for itself. You know, and you know, there's always talk about things like presenteeism and the impacts of these mental stress, these sort of emotional stresses when somebody's actually in work and not taking the time to look after themselves as well, and the impacts that can have on things like their productivity whilst they're in work. So if you start to factor in all of those things, it almost pays for itself to be able to support somebody in a sustainable fashion and keep them happy, healthy, and productive while they're at work as well.
Yeah. No, I mean, and I think for every business, as we go through these turbulent times, you know, it's how you treat people and you know, your reputation, it lives with you, doesn't it? And it's certainly not just with those folk, but it spreads sort of more far and wide. And it's so important that businesses continue to do the right thing, to look after people. Yes, there'll be challenges and some will be more impacted, but you've got to do things in the right way. And you know, the tool that you offer is a great way of ensuring that we do that. I would say that because we use it ourselves here at the chamber, so I sort of know from first-hand experience. But I mean, Karl, just to sort of wrap up, I mean, any final messages that you would sort of say to businesses who maybe don't fully utilize an EAP or don't have one right now, or are feeling that they want to do more for their staff but just don't know how?
Yeah, I guess what I would say is that before COVID hit, when I would talk to a client, I would talk to them in terms of what I call the iceberg effect. So the pressures and challenges that an employee faces almost represent themselves as an iceberg. So from an employer's perspective, they see the very tip, and that's the bit that you can see when they're at work. But in reality, underneath the surface of the water, there's a whole host of different complex problems that an employee is dealing with. I think in the world that we're in at the moment, it's quite evident that iceberg has almost been flipped on its head, and those issues, those problems are much more apparent, they're much more visible, and I guess my advice to any employer is that there are solutions out there that can cater for a large majority of those things, and that they're really simple to implement. They're very effective, and they can offer such a great level of support for employees, no matter what circumstances they're in. So if you're looking to provide any level of support, then my own personal opinion is that RISE is definitely a good starting point for that.
Yeah, no, I'd concur, and I think that's the key, isn't it? The support is there. You know, your people are absolutely essential. So, you know, if you want to find out more, then we'll make sure that Karl's details, and certainly BHSF is easy to find and to track down. And it's a great product, a great service. To say, you know, we know the organisation is rooted here in Birmingham, which I absolutely love as well. And although, you know, you obviously work all over, but I think from a Birmingham or Greater Birmingham perspective, really admire the work that you and the team are doing there. So, Karl, thank you very much for joining us.
More than welcome, Paul. Thanks for having me.
Great.